Welcome back, dear viewers. We have been joined here in the studios of Hala Kuwait with our special guest, Dr. Mohamed Shahid, oral and maxillofacial surgeon. Hello and welcome, doctor.
Hello, how are you?
I'm doing great. How are you doing this evening?
I'm doing good.
So, doctor, we'd like to know more about the face diseases. Which are the most common facial diseases?
Yeah, well, it's a perfect question. And we will start about the face and mouth diseases. So,
Yes.
generally the face is composed of skin and the bone and underlying structures. So what are the diseases which comes in the face, which is mainly the developmental diseases and the congenital diseases. So what are the developmental diseases, which means in case of the babies which is grows inside the mother's womb,
Yes.
so there will be a developmental changes. So it means once the baby grows inside the uterus, so the organs it will slowly develops. So there will be some alteration of the organ systems, everything. So it may cause slowly periodic changes of the development, which may cause severity of the diseases.
Yes.
So which means, so mainly we will talk about the face, which is the jaws, the upper and the lower jaws. So the developmental diseases, which are the diseases which is confined to the TMJ, which is called the temporomandibular joint. So it is overgrowth. It is like extra growth and also the less growth. So overgrowth, which means this we will say in the medical terminology, it's a condyle. It's like
Yes.
a condyle. It is called as a condylar hyperplasia. So when generally we will see the faces of the kids, it's one side of the joint is little prominent. It will be little enlarged. So it is
Yes.
like so we will say about the asymmetry. So one side of the face is little enlarged.
Yes.
So it is one of the developmental disorders which are affecting mainly for the kids.
Yes, of
So
course.
which is called the developmental anomalies, we will say. So other than this, it will affecting the skin and the underlying structures of the face.
Yes, doctor, I actually have one of my friends.
Yeah.
This is like something very normal. It doesn't even show.
Yeah.
She has like her jaws a little bit forward.
Yeah.
So they told her that she has to do like surgery, and it's kind of been corrected at a very
Yeah.
young age.
Yeah,
Yes.
interesting question. So it is mostly seen in the adults. So it is called as a skeletal deformity. It is abnormal bone growth.
Yes.
So which is after while growing stage of the adult. So it will like a prominent jaws, which is abnormal bone growth, which is seen in the lower and the upper jaws.
Yes, that is true.
So it will it's like an ugly look when we see the patients. I can see a lot of cases. So what is the better way to correct this problem is only the surgical correction.
Yes.
There is no other ways to correct for this kind of diseases only. So what we will do is we will just cut the jaws according to the proportion. We will just cut the jaws in front, and backward we will set back it. That's it.
Yes, and what about the not normally growth jaw? So it's kind of going inwards.
Yeah.
What about this kind of problem? How can you solve this one?
So which means the jaws are, it is like a setback position.
Yes.
So the same like we will cut the jaws and we will separate in between and we will get it front.
Yes.
So the facial asymmetry, it will be get corrected. So the looking of the ugly look, it can be prevented.
Yes, and
Yeah.
what are some of the other kind of diseases that you might face that are most common on the face?
Yeah, the most common face diseases we can see, it is like cyst. It is like a collection of fluids
Yes.
in the jaws and the face. So this face and the mouth disease, which is not similar, it is entirely different.
Yes.
So when we see about the faces, so there is I already told about the developmental diseases. So when we talk about the other than this nerve disorders, especially the neuromuscular disorders, so which is seen in the face, so which is the asymmetry. So one side of the face looks like asymmetrical. It is not symmetry.
Yes.
So especially the main problem is the facial palsy, we will say. It is like a one side paralysis of the face. So most of the peoples, they will think about the facial palsy it is like something related to the neuro disorders. Yes, it is a neuro disorders. So there is two kind of things. So one is if there is any tumors which is affecting the brain, and
Yes.
also it's there anything abnormality, it's kind of traumatic injuries when the people attempted the accident before, and kind of injuries affecting the brain. So it can be one of the cause which can affect the facial paralysis, which means the one side of the muscles of the face are getting affected.
Yes.
So the tumors which can compress the nerves inside the brain, which can affect the nerves which can supply the face of the muscles, so it is temporarily interrupted. So which can cause the paralysis of the facial muscle. So the patient, the patient, they cannot clench the teeth. So the expressions of the face, it get depressed. So other than this, there is another thing. There is another factor. It has a multifactorial. It is some viral infection. It is a temporary one. The before one I said is a permanent one. The temporary one is it is due to the viral infection. So it can cause, often it can cause some people, it is like an on-off like that.
Yes.
So sometimes it will stay for 14 days and it will go back.
Okay, so does it come back again, or?
Yeah, it can be.
Yes.
But there is various treatment modalities are there. So according to that we can go through this.
Yes, of course. And so there is no kind of correlation between face and mouth diseases, or is there?
Yeah, interesting question. Yeah, the face and mouth disease, which is similar, as I told before, it is not the same one. Yes. It is a different way. So mouth diseases, what are the mouth diseases, which means? So mainly the upper and the lower jaws. So we can find a cystic collection in the jaw bones. Yes. Which is in the upper and the lower jaws, and the tumors. So the cyst and tumors are not same. It is entirely different. So cyst, which means the collection of the fluid. The tumor is a tumorous growth of the jaws. Yes. It is. So when the people find the symptom, which is if there is a swelling, is a abnormalities of the jaws. So when it can happen, which means it is related to two disorders. One is the teeth, mainly inside the teeth involving the area. Yes. The other one is the teeth not involving areas. So it is mainly majority of the infection of the cyst in the jaws mainly coming from the teeth. If the infection from the dental caries, it can penetrate into the nerves of the tissues, everything. So it can spread inside the jaws. So it will form as it is like a chronic inflammation inside the jaw bones. It will present as a cyst. So people, they doesn't know what is happening inside the jaws, everything. So when they will know, which means they will get a symptom, it's like a pain or a swelling. So the pain is not always a common symptom. Sometimes they will get a painless swelling. If it is without pain also, they can realize there is something problem which is happening inside the jaw bones like that. Yes, okay. So other than this tumor, so tumor, it has more variety. It is like a benign tumor, so benign which is non-cancerous. Yes. So the another one is cancerous tumor, so which is entirely different. So benign, it is completely normal. It can be treatable. Yes. So when we go for the malignant, which is called as cancerous tumor, it is little bit dangerous. It is very hard to treat. It can be treatable, but it has more things to do. Yes. So when we talk about the benign things, there is lot. The most commonly one is the we say it's like a amyloblastoma. It is like a amyloblastoma, which means the dental area, which is covering the jaw bones. The tumor arising from the dental origin. When the tooth is growing inside the bones, so it will form some kind of developmental issues inside the jaw bones. It will expand as a tumor. So initially it will start from this after birth. We didn't know what will happen inside the jaw bones like that. Yes. So it is the most common tumor. It is called as the amyloblastoma of the jaw bones. And cyst, I said, which is called as some kind of cyst, which is mostly seen in the back side of the jaws. It is the posterior side of the jaws. And this is something that happens from birth, or does it occur as you get older? No, it is not like age predominance and all. It can be happens after the birth, and it can be happens the 30 decades and the 40 decades of the life, especially. But when we talk about the cancerous thing, which is the tumor, the long-standing benign tumor, I mean like this amyloblastoma, if it is present for the more than 15 years, 20 years, it has a chances to develop as a cancer, which is called ameloblastoma carcinoma like that.
Yes,
so
of course.
it is very dangerous for this.
And it's very important to watch out for it before it becomes cancerous.
And the another thing, especially we all know about the oral cancers. Definitely, we have to aware about the oral cancer. So oral cancer, which means it is a multifactorial. It has more causes. So mostly, if you want to see about this, mainly it is from the smoking issues and kind of factors are there. But when I see here, most of the cases, it is from the local. We will say it's a local factors. You mean, is there the sharp tooth which is irritating the tongue or anywhere inside the mouth?
Yes.
If it is irritated for the long time, it is like it has been like a 1 month, 2 months, 3 months like that. So it may develop as a ulcer. It is ulcers of the tongue like that. So if it stays, it is like we will say about the non-healing ulcer. It is like a chronic ulcer.
Yes, you cannot cure it.
Yeah. If it is non-healing ulcer which stays for more than 15 days, it is 15 days, it will transform as, it is denoted as a oral cancer after confirming the biopsy. It is like we will remove a test, like a small portion we will remove from that area, we will test it in the lab.
It and then we know.
Yes, that is very important.
And doctor, you mentioned earlier that smoking has the negative effects, of course, on our health and our oral mouth and everything. So what type of smoking has different effects? Because we have a lot of different smoking nowadays. We have tobacco, we have cigarettes, we have shisha, we have even electronics. A lot of people are smoking electronic cigarettes nowadays.
Interesting question. So we have to focus on this mainly. So when we talk about the cigarettes, it contains nicotine.
Yes.
We all know about it is tobacco. It is a carcinogen. What is a carcinogen? It's a cancer-causing agent. So which is seen in the tobacco. So when the person smokes, what will happen? It's not only the oral cancer. It is mostly involving the lungs.
Yes,
also.
Of course.
So what it will happen? It will change the normal DNA inside the tissue area, especially in the oral mucosa as well as the lung.
Yes.
So it can change the normal tissue to the abnormal tissue. So what the mechanism which will happen inside the tissue, there will be alteration of the DNA. So it will cause like a proliferative, there is a abnormal change in that surface. So it will present as a cancer, especially oral and the lungs.
Yes,
so as you said about the types of cigarettes, we can see the normal cigarettes and the e-cigarettes and all. So all which contains same things. So better it should be avoidable. Better,
yes, it's better to avoid them all at once. Yes, of course. And doctor, we'd like to know more about the most common mouth diseases because you mentioned a few, and we'd like to know more about them.
Yeah. So, like common oral diseases, which means patient can exhibit, as I said, the tumors and the cyst, other than the oral cancer.
Yes.
So it is like autoimmune diseases. Some people will having the autoimmune diseases, like the body auto antibodies. It will develop, which can causes some kind of problems. That not only involving the oral, it can affect the
entire body.
Yeah. So it is the most commonly seen in the mouth area also. So what it is means, it's like a whitish lesions, like a ulcer it can develop. So as I said before, the oral cancer.
Yes.
So other than this, there are some related ulcers are there. So which is called the pre-malignant lesion. Pre-malignant, which means the ulcers which can come before the cancer.
Yes.
So in this stage we can prevent the things. It will not penetrate to the further stage.
Prevent it.
So it's like below the first stage of the cancer.
Of course.
So most commonly I can see some kind of ulcers like a leukoplaque. It's like a whitish appearance inside the mouth, both sides of the mouth.
So this is something that the patient would notice, or is it something because of the
sometimes it is noticeable. Sometimes. But when it is noticeable, patient will exhibit some kind of burning sensation when they eat some food. Not even the spicy food, normal food, it can causes the burning sensation. So that is one of the first symptoms. It is like a burning sensation of the mouth. Sometimes it's like tumorous growth. They can feel some kind of lumps inside the mouth and also the necks also. So once the lumps which is seen in the neck, which means something it is penetrated or spreading inside
the
the
mouth
body,
as well, yes.
different regions,
Yes.
like that. So that is mainly, I will say, everyone they should make the self-examination when we see in the mirror. When
Yes.
can once in a week they can see in the mirror. By seeing the mouth, they can check any ulcers or any whitish appearance inside the mouth.
Yes, of course.
So they
that's very
can
important.
self-examine before going to the specialized doctors.
Yes, because sometimes a lot of people even don't go check up until they
Yeah.
have like some kind of pain
Yeah,
or some kind of issue with their gum, and that
Moreover,
might delay
in kind
it.
of the chronic cases, like if it is cancers proceeding for more than 6 months, they will not
Yes.
find any pain actually. So in the advanced stages, they can feel some kind of pain and the bleeding can occur.
Yes.
So always better to check the mouth once in a week if there is some alteration which is seen in the mouth or anything.
Yes, and
like-
doctor, how much time do you recommend for patient to go visit the doctor? Like, is it once a month just
Yeah.
to make sure, or is
Well-
it like once every 3 months?
Yeah, actually the patient should visit the specialist doctor, which is more specialized for the face and mouth.
Yes.
Once in 6 months it is better.
Yes, of
So
course.
better to diagnose is there any alteration of the mouth or face, whatever, anything.
Yes.
So if there are further investigations are there. If it is there, the doctor will advise for if there is any investigation is needed or not. So
Yes.
according to your question, so it is better to visit the doctor at least 6 months.
Yes.
Yeah.
And of course, there's a lot of diseases with the face and, as we mentioned, in the
Yeah,
mouth.
yeah.
So who are most common for getting these kind of diseases? Is it the children? Is it the elderly? Or is it something that just happened, as you mentioned, at birth or with time at the
Yeah.
30s and 40s?
Yeah, well, there is a gender predominance. Most commonly, we will talk about the kids especially. So as I
Yes.
said, the kids, there is a specific disease which is called the TMJ ankylosis, which means the diseases which is seen in the joint bone, ear joint, which is
Yes.
called the TMJ ankylosis. So when it will happen, when the childhood period, when the child fell down,
Yes.
so if there is any injury to the joint, so it will form as a clot here. It is like a blood clot.
Yes.
So it will stay for a long time. So in future, while growing period, it will forms as a ankylosis. What is this ankylosis? It's a complete fusion of the joint bone to the bone. So the child cannot open the mouth. It is very difficult to open the mouth.
So since the incident, he can't open his mouth properly, or is it when he develops and becomes older, that's when he notices this kind of problem?
Yeah, all kids they will notice some kind of pain in the joint bone.
Yes.
So the 100% main symptom, which is it's difficult to open the mouth. So the mouth opening, it will be completely less.
Yes.
It will be a closed state. So that stage, we will take the patient to the further investigation, which is we can go for the CT scan.
Yes.
So in the CT scan only we can see what is problem inside the joint bone. So we can see like a complete fusion of the joint to the skull.
Yes.
So it is one of the kind of diseases which is seen in the kids.
Yes.
And the face diseases which commonly seen in the children's, or like a cyst of the inside the tongue, like it is called a salivary gland cyst, like that. So most commonly seen.
So
But
this
it
is
is not-
usually that something requires surgery, right?
Yes, of course, of course.
Yes.
Yeah, which means what kind of surgery it will involve here is, so we will open here and we will just cut the separation. We will separate the fusion of the bone.
Yes.
And will make the something separation in between the bone, so that child can open the mouth easily.
Yes.
Yeah, that is the only way. So it should be executed immediately.
Yes.
Otherwise, it may go for complete closure of the mouth. So other than this thing is, as I said before, initially it's a congenital hyperplasia, the facial asymmetry.
Yes.
That is from the birth. It
Yes.
is from the congenital diseases, we say. So that case is very rare. It is, we can see it is very rare cases for the kids. So when we talk about the adults, especially in adults, so gender predominant is more for the males. For the oral cancer, more commonly seen in males, as the smoking effect is more common in the males.
Yes.
And moreover, other than the face diseases, which is like what we say, something, the skin diseases like abrasions, like skin disorders, that is very uncommonly we can see that. And the mouth diseases, which is salivary gland, we have a salivary gland, it is called a submandibular gland here, and the parotid gland here. So even last week also I had a patient, it is like a chronic swelling in the jaws. So it is very difficult to find out such cases, such diseases.
Yes.
So what is, it's something like a urinary stones, we know, right? Like renal kidney stones.
Yes.
Yeah. So in saliva, our saliva, if it is very thick, so it can stagnate the salivary fluid and it can develop as a stone. It is like a calcium and phosphorus stones.
Yes, and this happens in the jaw.
Yeah. It is mainly in the salivary gland. We have a gland inside the neck, below the jaw. So there is a duct which can comes inside and opens in the mouth, which can give saliva to lubricate the mouth.
Yes, this might be very hard because a lot of people, they don't drink water. Could that be one of the main reasons?
Yeah, usually we will advise to hydrate the patient. We have to hydrate more like that. So most commonly it is due to the high content of phosphorus and calcium in the body. It can stagnate and it can form as a stone inside the duct.
Yes.
So it is very painful condition. It may cause the infection and it will block the same like a kidney stone. So in such cases, surgery is immediately, it is only the better option for that.
Of course. Yeah. And we'd like to know more about vaccination. Does vaccination have any kind of effects on the face or mouth diseases?
Interesting questions. Vaccination, it is not actually.
Yes.
There is no report about the vaccination can cause the face and mouth diseases. But especially when we talk about the COVID, there is a lot of things, reports are there, which is called the black fungus, which can affect the face. So it is recently reported in some countries. So it's called as a mucormycosis. It is a fungus which can affect the jaw bones.
Yes.
It is mainly after it's like COVID affected patients like that.
Yes, of course.
So other than the diseases which is mainly affecting the jaw bones, which is called the osteomyelitis and the osteoradionecrosis. So myelitis means infection of the bone, the jaw bones. It is mainly due to the chronic infection inside the teeth or any chronic infections inside the mouth.
Yes.
If it stays for the long time, it can happen as inflammation of the infection of the bones. So it can be diagnosed only by CT scans, some kind of investigations. So other than this, there is a very interesting disease which is called osteoradionecrosis.
Yes.
Which is a dreadful disease. So it is very rarely we can see, especially seen in the older peoples. So what it is, if the people's taking like anti-resorptive drugs, which called especially when we see the older ladies, they'll be having osteoporosis, like bone melting diseases. So for that they will take it's kind of anti-resorptive drugs.
Yes.
So which can happen, it can in turn it will happen diseases which is in the jaws.
Yes, and these medication usually have these kind of side effects.
Exactly. So what will happen is, if the patients are ongoing therapy with such kind of drugs, if you do execute any surgery in the jaws, it can permanently damage the jaws. So it will be very careful when we are dealing with such cases.
Yes, of course.
So,
Doctor, thank you so much for your time, and we would like to hear one last word of advice you would like to share with our dear viewers.
So actually it's better to consult the specialist doctor once in 6 months, so that easily the disease can be diagnosable. So better to prevent further diseases. So better to avoid the further things. So to have a better life, and everyone have stay for that.
Yes, thank you so much, Doctor. It's been a pleasure to have you with us on Hala
Thank
Kuwait, and hopefully we'll have you again to talk more about these kind of diseases.
Yeah. And I would like to thank to Ministry of Information and the office bearers and the presenters and producer to giving a wonderful opportunity for this prestigious platform.
Thank you so much for coming, and it's been a pleasure to have you with us.
Thank you.
Dear viewers, we had with us Dr. Mohamed Shahid, oral and maxillofacial surgeon. Let's have a look at this report. It's about traveling season. Stay tuned.